March the 11th was the day that we were told that there is a presumptive diagnosis of COVID-19 infection in a patient of ours in the hospital. Incidentally, at that point of time, I was the only intensivist available in the hospital. So we set up a command center, and subsequent to that, we decided that there will be a multi-pronged approach in dealing with this particular crisis. So we had to take care of the ICU patients, including the COVID-19 patient, as well as to make sure that the spread of infection is very limited.
These patients are not as simple to take care of as our other patients. Usually you don't have a barrier. You can enter their room, you get to talk with the patients, you get to talk with family members in the room, and you get to explain the treatment options. You institute your treatment plan, you discuss the plan with the nurses, and then you wait. These patients, the care is incredibly different. Not only do you not have the family members to help support the patients, they don't either. They're nervous, they're stressed. The nurses, have been also dealing with this bravely. And in addition to just making sure that we're covered appropriately with the PPE, we are going into our patients with everything that we can to treat them.
This is a novel disease. We had no idea of exactly how effectively are we going to manage these patients. I did some literature search, talked to the pharmacist as to what are the therapeutic options that we would have available in the hospital. I was also constantly in touch with the FDA and tried to see which are the investigational medications and investigational therapeutic options that would be available to us to try and use.
From a patient's perspective, they come into the hospital knowing the severity of the disease. They've heard about it on the news, they've heard of the death toll, and so they're scared. I've seen their families be very appreciative of the work that we've been able to do for them. That's hard. It's been so helpful to have families be on board with this whole process. And so they, not being there in the room, has been one of the tragedies of this whole process. Families understand and the patients understand the reason for the visitors restrictions. We can't risk someone else acquiring the illness. In addition to that, it's been personally hard and difficult.
Oh, clearly, I mean, the fear is enormous. Initially, the fear was a lot, when all of these things first started, and I was the only person there around, and all the time I was in the ICU and taking care of the COVID patients. So clearly there was a lot of exposure that I had with regard to this. So I remember the first few days, first few weeks actually, when I went to my house, I literally quarantined myself. I was in a single room in the house, away from the family. Only I could see my kids from a distance, associate with my wife from a distance.
Physicians, nurses can acquire the illness, have acquired the illness, and have become incredibly sick. Whether they have chronic illnesses, whether they don't, young and older age, everyone is vulnerable at acquiring this disease. So that's been very difficult. It's been difficult on our families. We've been instituting personal quarantines. We know that you can shed this virus and transmit it to other people, even if you're not experiencing any symptoms. So because of that, my colleagues and I have taken the extra step where when we go home, we maintain a distance. Those who have children have stopped being physically affectionate with them, no hugs and kisses for at least the last month. For those who are married or have significant others, they're not sharing the same room, they're not even sleeping in the same bed, they're not sharing the same bathroom. So that's been difficult. One of our biggest fears is that we'll transmit the illness or bring it home to our families.
I think this whole response has been a team response. It's not an individual response. All the respiratory therapists, all the nurses in the ICU, on the floors, they are the real backbone of this whole fight against COVID-19. Without them, I don't think so this is even possible for us to think about. I would like to tell the people that being involved with these patients from the very beginning over the last several weeks, I can tell that for majority of the patients, COVID-19 is a very mild illness. If you catch this illness, if your immune system is robust enough, you should be able to fight it off very easily. Most of the time you don't even have to seek the help of a physician. And our hospital's record has been very good with regard to treating the sick COVID patients.